Just okay. Deeper, we have muscus piriformis. We have gemellus superior, gemellus inferior, and in between we have obturator internus. And posteriorly we have muscus quadratus femoris. So piriformis, gemellus superior, obturator internus, gemellus inferior, quadratus femoris. We will probably pin piriformis and quadratus. The gemellus, we don't usually pin them. What is this? This is nervus ischiadicus, or the sciatic nerve, the biggest peripheral nerve.
The tensor fasciae.
Tensor fasciae lata here.
Because that's in the glute part now.
This is the iliotibial tract or iliotibial band, and here is musculus tensor fasciae lata.
Isn't it the gluteus maximus?
This is the gluteus maximus, but this is musculus tensor fasciae lata and the iliotibial tract or iliotibial band. Then we have quadratus femoris, which consists of four muscles: rectus femoris, vastus medialis, vastus lateralis, and deeply we have vastus intermedius. Four of the muscle are making the quadriceps femoris, which inserts with one tendon into the patella, and the patella inserts with ligamentum patellae proprium into the tuberosity, into the tibial tuberosity. Tuberositas tibia.
Now here the
what is this? Musculus sartorius.
sartorius, and then
Musculus sartorius.
then the G muscle, gracialis, it will come down.
This is musculus semitendinosus, and this is
Gracialis?
gracilis is the most part of this. And
By leg is the confusing one. Upper limb is very basic.
it's torn actually. This is the gracilis. So sartorius, semitendinosus, and gracilis are making pes anserinus superficialis, the insertion point on the medial proximal side of the tibia. Underneath we have pes anserinus profundus, which is made from semimembranosus.
Semimembranous is like
So
back here.
semimembranosus making pes anserinus profundus, sartorius semitendinosus and gracilis making pes anserinus superficialis.
Okay. And there were like some muscles back here, I believe.
Yes.
The
We have-
maximus minimus and obtuse something.
That's you.
We
It's
have
somewhere here.
musculus psoas major and musculus iliacus combining together and making musculus iliopsoas as a whole.
And then there was like,
Psoas major, iliacus.
okay.
Inguinal ligament here.
Okay. Where?
This is the inguinal ligament.
Okay. And there were some more muscles here, I believe. I think. It was like
Part of the iliacus. And yes, we have, but for simplicity,
We
on the
don't need to know
colloquium,
that.
yes.
it was like of something. There was the maximus, then there was something in between.
No,
the minimus.
this is on the back side.
No, not the glutes. The glutes I know. There was like some. Okay, never mind.
For simplicity, we'll not pin them. So what is this?
Yeah, the three. And then
They say
Muscles.
it's together most of the time.
it goes from for the femur
I
something.
think it's behind, right?
No, this is easy. This is musculus.
No,
No,
Musculus. This is
that's a
arteria.
arterial.
No, arteria iliaca communis, bifurcating into arteria iliaca interna for the pelvis and arteria iliaca externa going downwards, traveling around 10 to 12 centimeters, going under the inguinal ligament, and it's now arteria femoralis.
this inferior gemellus and something.
I showed them?
Yeah, you did.
Yes.
Obturator interna.
So, arteria iliaca externa travel through the inguinal ligament, and it's now arteria femoralis. Arteria femoralis travel in the center of the femoral triangle, going medially into the Hunter canal or the adductor canal, and it's now on the posterior side, no longer femoral artery, is arteria poplitea. Arteria poplitea travels around 15 centimeters, then bifurcates into arteria tibialis posterior, which is the main artery of the lower limb. We can see it. We can see it here, near the medial malleole, and arteria tibialis anterior, which travels anteriorly and ending as arteria dorsalis pedis, which we can see between the first and the second metatarsal. It's a pulse point for the foot.
The posterior one is this one. Third review.
That's a yeah, that looks
Yeah, this is arteria.
No, this is artery. He's right. This is arteria tibialis posterior, the main blood supply. What happens with arteria tibialis posterior? It runs behind the medial malleoli and goes into the plantar region. Into the plantar region, we have only one arch. On the hand, we have two arches. Here, we have only one arch. Arteria tibialis posterior
That's what an arch is.
bifurcates and gives to arteria plantaris medialis, arteria plantaris lateralis. The arch is actually from arteria plantaris lateralis. Arteria plantaris medialis only give one branch for the big toe.
Okay. Did we discuss?
Arteria plantaris lateralis is making the arch, giving the interdigital arteries, two for each of the fingers.
Did we discuss the posterior?
No. So this is sartorius. What are what we have here? The femoral triangle. Which are the borders? The superior border, inguinal ligament. A medial border, abductor magnus. Adductor magnus. Lateral border, sartorius. The roof is the skin and the superficial fascia. What is the opposite in English of roof? Floor. Sorry. Yes.
That's a good delay.
I had pretty long week with lots of surgeries and lots of hospital work, and my head is burning. So sorry again. So the bottom is from adductor magnus and musculus pectineus, and part of adductor longus. So adductor magnus. Adductor magnus, actually, this adductor longus, and the small is pectineus.
Which is pectineus?
Okay, this is the posterior. Right?
This part is pectineus.
This is the pectineus is very small.
It's a small muscle, yes. What we have into the This is pectineus. What we have into the femoral triangle. From medial to lateral, we remember from medial to lateral van. Vein,
Artery, nerve.
artery, nerve. Femoral vein, femoral artery, femoral nerve. Vein, artery in the center, and nerve.
At the back.
It's not one nerve, it's actually nerve fibers.
Several.
So this is the nerve fibers of nervus femoralis.
Okay.
The vein and the artery travel under the inguinal ligament in topographic region called lacuna vasorum. Vasorum from vessels in Latin. So lacuna vasorum consists of the vein femoral and the artery femoral. Lacuna musculorum is the place where the nerve travels also with the tendon of musculus iliopsoas. That's why it's called musculorum. It's for the muscle, the tendon actually, the tendon of iliopsoas and nervus femoralis.
Okay.
Two lacunas. Vasorum, the medial, for the two vessels, vein and nerve, and musculorum for the tendon of iliopsoas and the nerve. On the medial side, we also have small, it's not so small, it's lymph node. Rosenmüller-Pirogov lymph node.
Lymph nodes we haven't discussed yet, right? It's just for later, right?
Yes, it's full. You will learn it in surgery, just to know.
Okay.
We have. We described what happens with the artery, travels in the center of the hip, going medially into the adductor canal or Hunter's canal, and going posteriorly into
Then it
fossa
becomes
poplitea, and it's now this is
Tibia
the
or
artery.
something.
And it's now artery and the venous.
Okay, they're paired, right?
Yeah.
The same like
When
in
we
the
talk,
hand.
yes, when we talk about an artery, probably
It's
there is a
paired.
vein.
Ulnar and radial arteries.
What is this?
Sorry.
Vein and arteries are paired together.
Pretty
In
common
ulnar and radial.
pin. What is this?
This is
When?
It's a vein, yes.
What is the name?
Vena saphena magna. Vena saphena magna. It's the big magna for big, collecting all the blood from the bottom, like a flat tire. Veins
മറ്റേ വെയിൻ ഇച്ചിരി
are
കട്ടിയല്ലോ
like
ഫ്ലാറ്റ് ആയിരിക്കും.
proflat.
The English is no, yeah.
Sorry.
No.
Veins are it's like air. It has air inside of it. Very.
You're from India, right?
Yeah.
Yeah. I work with an Indian guy. He's here from. He's called Dr. Singh. He's from
Sing.
Singh.
So it's Punjab. Right?
Singh. So he's from Punjab. He's from
No, he can be from like.
He's from Mumbai.
From like.
Ah.
Mumbai down there.
Sarvanit is the first name. Sarvanit Singh. He's bigger than me. He's from 90 years here in Bulgaria.
90.
19.
Yes,
19.
he-
19.
He graduated here and he also got orthopedic surgery specialty. So 6 years and then 5 years surgery, 11 years and working.
Surgery is 5 years.
Yes,
ഓ ഹി സീനിയർ
orthopedic. Yeah, he's senior.
Maybe he will.
So vena saphena magna. Vena saphena magna. Inserting here into femoral vein. Here we can see arteria femoralis, and deeply the biggest branch is called arteria profunda femoris. You see? Arteria profunda femoris. Arteria femoralis. Arteria profunda femoris. Actually bifurcating, and now in some books they say this is arteria profunda femoris, and distally this is also said arteria femoralis. But in other groups, in other books they say that arteria femoralis bifurcates into two arteria profunda femoris, and now this is no longer arteria femoralis, it's called arteria femoralis superficialis. Because they try to make it opposite. The logic is if we have deep,
Okay,
then
it's
we
profund.
have then
If it's profund,
it
it's
gets
deep, yeah?
yeah, but you can say that
The top one is
the
superficial.
one
Yeah.
The arteria profundus.
Okay.
this hole is arteria femoralis, giving its biggest branch profunda femoris. If you want, you can say it gives profunda femoris, and now this is superficialis.
The muscle.
And you see this, these the femoral artery give 3 or 4 perforating branches. Arteria perforantes.
Do we need to know?
Yes, they're very important. When we do surgeries and we cut this,
It's very bad.
it bloods,
Bleed.
it bleeds like crazy.
Professor, so arteria femoralis perforantes, something like that?
In upper limb, the
Arterii
branches are not
perforantes,
important.
only perforantes.
Arteria profunda.
A dot perforantes. They're usually 3. In some we can see 4. Here we can see 3. 1, 2,
Okay.
3, and maybe I'm not sure.
Oh, okay.
Most of the time they're 3, but
And the
sometimes
muscles are be done with the posterior hand, right?
we'll get there.
मैं आगे किए बस आधा घंटा हो गया
Oh, you കാലിന്റെ back ആണ്.
So nervus sciaticus.
Calf side.
Hamstring.
This is
This is the posterior.
the biceps, the biceps femoris. It's torn. Biceps femoris.
No, it is written in the screen. Oh, okay. Yeah, sorry.
You see here, arteria and vena poplitea. Arteria poplitea, vena poplitea. Try to squeeze it and see which is the artery and which is the
It's the vein, right?
This is artery.
this is the artery.
Wait. One hand, guys. One hand. Who wants to put the hand beside?
This is the artery, and this is I can squeeze it easily with the.
And that's the vein.
This is the vein.
Vein in a flat.
And yeah, it's like a flat tire. And this is the nerves, the sciatic nerve.
Okay. So can you show me the biceps and the triceps of the legs?
Which
Biceps, like the biceps part.
This he just showed it like here, I think. From here.
here, it's torn.
Okay.
It's torn. The
So this one is the
femoris,
Biceps.
biceps femoris. What we have here,
Triceps.
calf, triceps.
we have muscus gastrocnemius,
Yeah, gastro, and then there was
lateral head, medial head, and underneath muscus soleus, making triceps surae, which inserts via the Achilles tendon into the calcaneus. And we have, what is this?
This is it's some ligament.
No, it's a muscle.
No,
It's a muscle.
this is the
If I want to be bad, I will pin this. And I think 90% of you will get wrong.
muscle.
It's a muscle, but
No, देखिए पता चल रहा है मुझे.
which muscle?
Other thing.
Muscus plantaris. It's a very small muscle. You see here? If we continue, this is the muscle, and this all is the tendon
This is the
part.
smallest muscle in our body.
Calcaneus.
It's the smallest muscle in our leg.
It's a thinnest.
Oh, it's thinnest muscle. Okay.
there is a difference.
Plantaris.
ഞാൻ പറഞ്ഞേ മനസ്സിലായി.
It's usually
Inside.
beneath the Achilles tendon. It's like this. Muscus plantaris.
What's that? Musculo?
Muscus plantaris. Plantaris. Plantaris.
Wants to be bad. And there is one muscle here.
This is the
Yes.
medial. It's the
You
lateral.
don't need to know.
At a medial
Remember there is things there. I don't know their names. See, I know the pictures. I have like
Lateral. This is lateral.
This, it's easy to remember. the thumb is on the medial side, right? So this is the medial gastrocnemius, and this is the lateral. And here is soleus, and then plantaris.
Plantaris is in the inside.
What is this? Tibialis anterior. Tibialis anterior. And here on the back we have tibialis posterior. Here on the back.
Oh, so can you show me?
Tibialis anterior.
And this is posterior.
Tibialis posterior.
Here, tibialis posterior.
Tibialis muscle ന്റെ refer ചെയ്യണോ? Okay.
Extensor
Okay.
digitorum. We have extensor caucis longus, pollicis on the hand, caucis on the foot. Caux is the big toe of the foot. Pollicis is the extensor caucis longus. This is the tendon of which? Tibialis
How do
anterior.
we differentiate between tendon and muscle?
You see, muscle.
Oh, the one that looks silverish.
It's like silver tendon. Yes.
Okay, this one is the tendon.
So every muscle insert with its tendon. So we say this is the muscle body, this is the muscle body, and this is the tendon. On the exam, on the
This is the
colloquium, if you have pin here or if you have pin here, you write musculus edikois in Bulgarian. Whatever. In Bulgarian is edikois. Edikois. For example, in this situation, musculus tibialis anterior. You don't need to write this is the tendon of musculus tibialis anterior. If the pin is here, musculus tibialis anterior. Done. That's it. Safena magna.
This one is the
Extensor caucis longus. Longus. We have two interesting muscles here.
I will not let myself go over 100.
Musculus peroneus. Musculus peroneus longus and musculus peroneus brevis. Here we have musculus peroneus tertius, but we don't pin it. Musculus peroneus brevis and musculus peroneus longus going here in the deep and going here on the plantar
which one
side.
was the longest again?
Longus is this. Brevis is this.
And
Here.
Here,
This is-
longus, brevis.
The
Longus,
big one is the longest.
Which one?
yes. Longus,
Longus,
brevis.
brevis. And
So the
here, this is longus and this is brevis.
This is brevis, ending here into the base of the fifth metatarsal. The longus travels and goes on the plantar.
so what's the name of
Peroneus.
Pego?
Peroneus.
Peroneus.
Or fibularis
Peroneus.
is the phase. Peroneus and fibularis is the This is semitendinosus actually. Semitendinosus because half is muscle body, half is tendon.
And then, oh,
Semitendinosus.
semi-tendinous.
Tendino. Semi-tendino?
50-50.
50-50.
Yes.
This part is tendon.
Yeah.
This is actually pes anserinus superficialis, made from the insertion of semitendinosus, sartorius, and gracilis. The three muscles. Pretty much that's it. We have some muscles here, but we will not put pins there. We have the small flexors of the thumb. This is the plantar
Okay.
fascia. We will not put pins here.
Okay, thank you.
You can create
Okay.
a more bigger deficit.